Have you ever felt trapped in the maze of your own thoughts? Or maybe you've experienced days that feel like a silent battle between what you feel and what you show the world. If you've ever felt that way, you're not alone. But here's the good news. Behind the complexity of mental health struggles, there's real hope. That hope is called therapy. In this video, we'll break down what experts say about the most effective types of therapy, not just in theory, but backed by scientific research, clinical experience, and real-life outcomes. We'll explore various therapy types, their benefits, their challenges, and how to find the right one for you. This isn't just information. This could be the beginning of real change in your life. When we talk about the most effective therapy, it's important to understand that effective doesn't mean a quick fix. Effectiveness in therapy is measured by how significantly it reduces symptoms, improves quality of life, such as social relationships and work productivity, and whether the benefits last over time, even after sessions end. These outcomes must be backed by strong scientific evidence, including randomized controlled trials, RCTs, meta-analyses from multiple studies, and direct feedback from patients. But beyond data, effectiveness is also personal. What works for one individual might not work the same way for another due to differences in personality, trauma history, cultural background, and even neurobiology. Therefore, while we rely on data to guide us, we must also respect the individual experience of healing. True effectiveness combines science and subjectivity. Cognitive behavioral therapy, CBT, is one of the most frequently recommended therapies due to its flexibility and robust evidence base. It works on the principle that our thoughts, feelings, and behaviors are interconnected. If we can learn to identify and change distorted thinking patterns, like catastrophizing or all-or-nothing thinking, we can influence how we feel and act. CBT is goal-oriented and time-limited, often structured around specific issues like panic attacks, social anxiety, or depressive episodes. Techniques include identifying cognitive distortions, journaling, behavioral experiments, and developing healthier coping strategies. The therapist acts more like a coach or collaborator, guiding clients through structured exercises both during and between sessions. One of the reasons CBT is so widely respected is because it's measurable and adaptable, making it a top choice for clinical trials and real-world application alike. Yet, its effectiveness doesn't mean it's always easy. CBT demands active participation, self-honesty, and a willingness to challenge long-held beliefs. Exposure and response prevention, ERP, is a specialized form of CBT considered the frontline treatment for obsessive-compulsive disorder, OCD. OCD often involves intrusive, distressing thoughts, obsessions, and repetitive behaviors or mental rituals, compulsions, done to relieve anxiety. RP addresses this by helping clients gradually expose themselves to feared stimuli without engaging in their usual compulsive responses. For instance, someone with contamination OCD might touch a public doorknob and then refrain from washing their hands. Through repeated exposures, the brain learns that the feared outcome either doesn't happen, or if it does, it's tolerable. This process is called habituation. RP is highly structured and requires courage, as it involves doing the very things that trigger a person's deepest anxieties. However, the results are often life-changing. Long-term studies show that ERP can dramatically reduce symptom severity and help individuals reclaim their lives from the grip of compulsions. Acceptance and commitment therapy, ACT, offers a fresh and empowering perspective on mental health. Rather than trying to eliminate distressing thoughts, ACT teaches people how to relate to them differently. It encourages us to accept internal experiences without judgment, diffuse from unhelpful thoughts, and stay grounded in the present moment through mindfulness. Central to ACT is the idea of values, guiding principles that give life meaning. When people feel lost or anxious, ACT helps them reconnect with what matters most and take committed action, even in the presence of discomfort. For example, a person with social anxiety might still attend a public event because connecting with others aligns with their values of friendship and growth. ACT is particularly helpful for people with chronic conditions, such as long-term anxiety, depression, or trauma, where the goal isn't to cure, but to live a rich, meaningful life despite ongoing challenges. It's not about fighting the storm. It's about learning to walk through the rain with purpose. Psychodynamic therapy delves beneath the surface to uncover the unconscious forces that shape our behavior and emotional responses. Rooted in Freudian psychoanalysis, this therapy explores patterns that stem from childhood experiences, unresolved conflicts, and suppressed emotions. It's particularly useful for people struggling with chronic relationship issues, self-esteem problems, or long-standing emotional pain. Through open dialogue and reflection, the therapist helps the client make connections between past and present, often revealing patterns they were previously unaware of. For instance, someone who repeatedly ends up in emotionally unavailable relationships might discover they're reenacting unresolved childhood attachment wounds. While it may take time, psychodynamic therapy offers deep insight and lasting transformation. It helps individuals rewrite their emotional narrative and develop healthier ways of relating to themselves and others. Eye movement desensitization and reprocessing, EMDR, is one of the most effective therapies for trauma, particularly post-traumatic stress disorder, PTSD. Developed by Francine Shapiro, EMDR uses bilateral stimulation, often through side-to-side eye movements, while the client recalls traumatic memories. This process is thought to help the brain reprocess those memories and store them in a less emotionally intense way. Unlike traditional talk therapy, EMDR doesn't require clients to explain their trauma in great detail, making it especially suitable for those who struggle with verbalizing their experiences. EMDR typically follows an 8-phase protocol, including preparation, assessment, desensitization, and installation of positive beliefs. Clinical research shows that EMDR can significantly reduce trauma symptoms in a relatively short number of sessions. For many, it feels like finally letting go of emotional weight they've carried for years. It's not just about talking. It's about transformation at the neurological level. Mindfulness is the practice of becoming fully present in the moment, without judgment. In therapy, mindfulness is a powerful tool for managing overwhelming emotions, breaking habitual reactions, and cultivating a greater sense of peace. Therapies like mindfulness-based stress reduction, MBSR, mindfulness-based cognitive therapy, MBCT, and dialectical behavior therapy, DBT, incorporate mindfulness to help individuals respond rather than react to distress. These approaches are especially effective for conditions like depression, anxiety, borderline personality disorder, and chronic pain. Mindfulness trains the brain to slow down, observe thoughts without getting lost in them, and return to the now. For example, a person with panic attacks can learn to anchor themselves in their breath, observe the rising sensations without panic, and let the wave pass. Through consistent practice, mindfulness builds emotional resilience, increases compassion, and fosters a deeper connection with life as it is, not just as we wish it to be. Sometimes, despite best efforts, therapy doesn't seem to work. But that doesn't always mean the therapy itself is flawed. Many factors can impact therapeutic progress. One major factor is the relationship between therapist and client. If a person doesn't feel seen, heard, or respected by their therapist, it can be difficult to open up. Therapy also requires readiness, emotionally, mentally, and practically. Someone attending sessions out of pressure from family or who expects instant results without self-work may find themselves disappointed. Trauma survivors may need time to build enough trust before deep healing can occur. Additionally, mental health symptoms such as dissociation, avoidance, or high emotional reactivity can interfere with the therapy process if not handled carefully. That's why therapy isn't one size fits all. If one approach or therapist doesn't work, it's okay to try another. Healing is rarely linear. It's often a winding path of trial, error, learning, and courage. Finding the right therapy is a deeply personal journey. Start by reflecting on what you're struggling with most. Is it trauma, anxiety, compulsions, relational issues, or a lack of meaning? From there, research evidence-based therapies that match your needs. Talking to a licensed professional, such as a clinical psychologist, can provide clarity and guide your direction. Some people find success in structured, short-term methods like CBT, while others benefit from the depth of long-term approaches like psychodynamic therapy. It's also okay to combine methods. For example, someone with OCD might do ERP while also attending ACT-based group therapy. The key is to stay open and curious. Therapy is like finding a good pair of shoes. You may need to try a few before finding the right fit. And when you do, it can take you far. Whatever you're dealing with, remember this: you are not broken. You're a human being navigating life's complexity, and that takes immense strength. The most effective therapy is not always the one with the fastest results, but the one that helps you understand your patterns, transform your pain, and move closer to the life you want to live. Whether you're drawn to CBT's structure, ERP's boldness, ACT's flexibility, psychodynamic therapy's insight, EMDR's intensity, or mindfulness's calm, each method offers a path toward healing. You are not weak for needing help. You are strong for seeking it. And above all, you deserve peace, clarity, and a life led by values, not fear. If you found this video helpful, don't forget to like, share, and comment. This might be the turning point someone else needs today. Thanks for watching, and take good care of yourself.